Broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to AWCI's webinar. Today's presentation is A Shot in the Arm, What Employers Must Know About COVID Vaccination. I am Anne-Marie Salvatelli, AWCI's Director of Education. Before we start, a few housekeeping items. All attendees should be on mute during today's presentation. Should you have a question at any time during today's broadcast, please submit it using the question box in your GoToWebinar dashboard. We will have a Q&A at the end of our presentation, and we'll make every attempt to get to all of your questions. If you have any audio or visual issues during today's presentation, please do not hesitate to let me know by using the question or chat function in the dashboard. We'll attempt to resolve any issues that may arise as quickly as possible. A PDF for today's presentation is available for download in the Handouts tab of your dashboard. Now I would like to introduce our presenter, Kara Marcial. Kara is a founding partner of Con Maciel Carey LLP and chair of the firm's National Labor and Employment Practice Group. She focuses her practice on representing employers in all aspects of the employment relationship. In March of 2020, Ms. Maciel started her firm's COVID-19 task force, on which she advises employers on the employment law and workplace safety implications of COVID-19. The task force is a multidisciplinary legal and regulatory group comprised of dedicated workplace safety, labor and employment law, and litigation attorneys to help their clients across all industries manage the multitude of pandemic-related issues employers are facing and prepare for potential litigation that is around the corner. Ms. Maciel is a popular speaker at conferences and events across the country. She lives in the Washington, D.C. area with her husband and 2 young children. Welcome, Kara. It looks like you're just getting ready for using your slideshow from the beginning.
Yeah, I got confused. I'm sorry, Anne-Marie. I can go ahead and do that. Do you want me to do that?
Yeah, if you could, just from that.
Up. Can you see it? I don't know why it's not.
Let's see.
Sorry, everybody. I think it might be because I'm using a second screen.
Okay. There we go.
Okay, is this perfect? Can we see that clearly, everybody? Okay, great. Sorry about that. Okay, hi. Thank you. Thank you, Anne-Marie, for that introduction. I'm pleased to be able to present today's webinar to all of you. And here's a little bit brief agenda. We're going to start with the just background of COVID-19. I'm sure many of you are well aware of some of this, but I'm just going to do very high level background about where we are today. Talk about how you want to roll out vaccine programs. There's a number of different ways that you can do it, whether you just simply educate your employees, you could encourage your employees, you could even then incentivize them with some type of cash payment or bonus. And finally, can you mandate the vaccine program? Then I'm going to continue into various implications of a written vaccine program, including some privacy issues and confidentiality with respect to people's medical conditions, ADA accommodations in the event that somebody does not want to get vaccinated and requests an accommodation, and what to do in the case that somebody refuses to get vaccinated at your workplace. And then finally, I'll close with what your obligations are as employers after the vaccine. There's still some social distancing, some other things that you would still need to do according to the CDC, and I'll cover that, and hopefully, as Anne-Marie said, leave some time at the end for some questions. So with that, I'll jump right into the background of COVID-19. So these are some facts right from the CDC. This is a great, image. You can, print and copy this and get this right to your employees. It's important that everyone understand that getting vaccinated can help prevent getting sick with COVID-19. It's not necessarily, completely preventable, but it does help you prevent getting sick and certainly prevent some, severe illnesses and hospitalizations. People who have already gotten sick from COVID can still benefit from getting vaccinated. The vaccines do not have the live virus in it, so you cannot get COVID-19 from the vaccine. And it will not cause you to test positive on viral tests, as I mentioned, because it doesn't have the active virus in it. As of earlier this month, there have been, increased COVID vaccine distribution and initiations. So you'll see that we've got, 112 million people that have already gotten one dose. 66 million are fully vaccinated. So we're looking at about 33% of the population total. If we're looking at people over 18 years of age, that number increases to about 43% of the population. Fully vaccinated, we're about 25% of the population. And you can see that more people have gotten, the Pfizer vaccine, with Moderna as a close second. Johnson & Johnson is a little bit lower than that, and I'll talk about Johnson & Johnson. And then you can see, too, the different states across the country where they are in terms of reporting the total doses administered. Some states are further along than others, but it really demonstrates, I think, this slide and this picture of the United States, that it is a patchwork across the states. And some states are doing a better job than other states, and it just really kind of depends also county by county. So a little bit of background about COVID-19 vaccines, right? So we've got right now currently 3 vaccines approved in the United States. We've got Pfizer, Moderna, and Johnson & Johnson. As many of you may have heard this week, the CDC has suspended the Johnson & Johnson vaccines for further review because of some concerns of increased blood clots in women. I think it was a total of maybe 6 women that have received Johnson & Johnson vaccines that subsequently developed a blood clot. They don't know that it came from the Johnson & Johnson vaccine, but they are pausing the distribution of Johnson & Johnson right now. So many states, if they were rolling that out, have put those appointments on hold, and we're back to the Pfizer and the Moderna vaccines. All 3 of these companies, these vaccines, were authorized under the emergency use authorization in December and February under the FDA. And that's important because usually most vaccines need full authorization, but because of the COVID pandemic, they currently are under emergency use authorization, which makes some employers nervous that there might be more liability to them if they mandate the vaccine or they encourage employees to get the vaccine because it hasn't been fully tested. I think that there are some liability protections that can address those concerns. But again, it's still kind of too early to know in terms of what the long-term impacts are. But we do understand that it does provide good protection against the symptomatic illness and severe disease, hospitalizations, and death. There have been some side effects, allergic reactions. They are, a majority of them tend to be in women. Women tend to have more side effects than men, and older men and women have fewer side effects than middle-aged and younger. And again, it's just hard to know why. I think that is still all part of the test and the analysis. Once you get your first COVID test, the CDC asks that you register through CDC Be Safe tool, which is on their website, and they'll do some health screenings. and that's helping them enable to get some data in order to analyze some side effects and other reactions. If you go to get a vaccine, oftentimes the healthcare provider where you're getting it will ask you to wait for about 15 minutes after the administration of the vaccine to see if any allergic reactions are developed at that time. I haven't heard many news reports of that happening, so that's a good thing. There have been some instances of individuals developing COVID-19 symptoms after the vaccine. That's similar to, that's the side effects. That's the aches and the chills, some fevers. Those have lasted anywhere from a couple of days to a few days. Headache is often another symptom, and that goes away. It kind of just shows that the vaccine is working, particularly after the second dose if you have the Pfizer or Moderna vaccine. And those go away after that. We haven't had enough data on understanding how effective the vaccine is preventing transmission to others, right? So it definitely is important protection against your own symptomatic illness if you were to get it. I'm not sure if you can still be asymptomatic and carry the disease to others, which is why the CDC continues to support social distancing and mask wearing even after fully vaccinated. And then there's continuing data and testing on the effectiveness of variants. I think both Moderna and Pfizer have reported that their vaccine is highly effective on the more contagious strains that are going around the country right now. There's additional clinical trials ongoing. I'm hearing that we should be getting Pfizer should be seeking emergency use authorization for its vaccine for children 12 and older. So hopefully that will come out any day now, with the goal that at least that age should be able to be fully vaccinated before the school starts in the fall. And there are some ongoing trials for children 2 and older, as well as other clinical trials. And then worldwide, you've got the data just continuing to change, but vaccines are being approved all around the world. Different trials, different types of vaccines, and different effectiveness depending on the country. So who's eligible for the vaccine? We got guidance in 2020, which pretty much said, it should be, priority workers based on health, age. Most of the states made up their own eligibility rules based on age, based on health, and then based on your particular job. And a lot of them have made recent adjustments as time went on. We also started to see that the distribution by the federal government to states, that's how it was directly to the state. And then the state would distribute it to healthcare providers and to counties. It has varied state by state. Some pharmacies are now receiving the vaccine directly from the federal government. So that allows those entities to more widely distribute it, particularly in different parts of the county and localities where it might be more harder to get the vaccine. Currently, right, we had a first wave of healthcare workers getting the vaccine, people 75 years of age, public service workers, and some essential workers. Then we saw kind of the second wave of vaccine eligibility to the 65 years of age and adults with pre-existing health conditions. Some states now have shifted focus to all age groups. I live here in Maryland, and anyone over 16 years of age, regardless of your job, regardless of your health condition, are now eligible to receive the vaccine. So it really varies where you're located. Even could be by county. Even before Maryland opened it up to 16 and older, different counties had different eligibility. So it really depended on where you were and what you were able to get your hands on. So just be cognizant if you are, an employer with employees in multiple different counties who live in different counties, even in different states. I'm in the DC, Maryland, Virginia area where we've got, companies that employ workers in all 3 jurisdictions. Understand, and one of the things that you may have to think about in your education messaging is that the different states may have different requirements, and it's just something to be aware of and be cognizant. So there have been some challenges to vaccine access. right? In order to make an appointment, oftentimes it's easiest if you are on the internet and able to make an online appointment. So individuals who don't have access to the internet are having challenges getting the vaccine, or if they don't have a smartphone or computer to confirm the appointments. I'm also noticing that, there's no federal requirement, but a lot of healthcare providers are asking for IDs to verify, confirm that the person with the confirmation is actually the person getting the vaccine, and not everybody has a photo ID or a driver's license. So that's another barrier. Transportation to the vaccine sites, if you can't get it at a local health pharmacy. Sometimes the mass vaccination sites are large stadiums or other areas with big parking lots that aren't necessarily accessible by public transportation. So that's been an issue. Some hesitancy, cultural issues, vaccine. We're hearing a lot about vaccine hesitancy and figuring out ways to combat that. And the CDC has published a lot of different information that employers can use to overcome hesitancy. Other opportunities are partnering with different people within the community to overcome some of those issues. And then this mobility. Some with the Moderna and the Pfizer vaccine, it's about a 2 to 3 week period of time between the first and second shot, and you have some people who may be moving, and so it's hard for them to get their second shot. But there's a lot of things that you as an employer can do to help your employees overcome some of that if they have these challenges. There are good news, right? New technologies are coming down the pike. We're seeing some more approval of inexpensive and quick COVID test kits for workplaces at home. So it might be a lot easier for you to be able to, quickly test people even before they're fully vaccinated, or if you don't want to implement a mandatory vaccine program. We're hearing, more safety data is coming out, and I talked about the clinical trials for teenagers and children, as well as some thought around, opening up more venues. What are we seeing in terms of airports and sport venues and other music venues in terms of, canine screening or other types of screening to make sure that people are vaccinated. In this section, what I really want everyone to take away is understanding that the vaccine will prevent most, but not all infections, right? We know that it's not 100% effective. It will reduce symptoms and deaths. So it has a community health importance because it relieves the burden from the hospital and healthcare systems of not having those individuals having to be in the hospital and the deaths. Well, obviously, more vaccines will reduce the need for quarantine so people can get back to work safely. And as I said, not enough data about how it prevents transmissions. So it does not change the importance of how often you clean your hands, how often you practice your social distancing, wearing the face covering at work and in public. So with that, let's move over to a workplace vaccine program. So there's a couple of approaches that you can take in order to decide what you want as a strategy for a vaccine. One is to simply encourage, which means you're educating employees about the vaccine. A lot of what I talked about in my previous slides, that you can recommend employees can get the vaccine, but it's really ultimately an employee decision, personal health decision. And so, you don't do anything above just recommending them. Another option is that you can help facilitate the vaccine, whether you help administer vaccines on site or near work, whether that's partnering with a pharmacy to come on site to administer the vaccine for you, or at a location near your facility. That could be a useful approach if you do have a workplace or a workforce that is in that group of a lot of challenges to get the vaccine. If you have a workforce that doesn't have the right technology, smartphones or access to the internet, or doesn't have good transportation, or doesn't have a driver's license or ID. So that could be an opportunity. And I've heard of, farm workers, for example, in California, bringing people on site in order to vaccinate, their largely immigrant workforce. And so that could be some option that might be beneficial depending on the nature of your work. Another approach is to incentivize, right? So you want to provide the benefit for getting vaccinated either through a monetary reward, through time off, through some other type of incentive in order to further encourage your employees to get vaccinated. And then finally, mandate it, making it a condition of employment that everyone has to be vaccinated in order to return to work. So how can employers encourage vaccination, right? We talked about educating and recommending. The CDC has some really great toolkits on its website, and I encourage you to look at that. It creates communication plans in order for you to educate your workforce to overcome a vaccine hesitancy with reliable information. And you want to always use that reliable information and let your employees know the source of that information so that they can trust it in order to dispel any misinformation that may be out there. You also, as leaders in your organization, other company leaders are trusted voices. And if they say, get vaccinated, it might lend a lot of credibility and a lot of encouragement to your workforce that they feel that they can, it's safe for them to be vaccinated as well. And again, engaging with community leaders, whether you've got a unionized workforce, union labor has been, I've seen both sides of it where they've been highly encouraging. I've got, some clients that are unionized in the LA area, and the union is, literally signing people up themselves to help them with those, making those appointments, finding times. They partnered with the healthcare system to block out days just for the union members to be able to get vaccinated. And then so the union is partnering with them to do that. So there's a lot of different types of opportunities in order to recommend and encouraging your employees to get vaccinated. As I said, you can help your employees make vaccine appointments either by providing, internet access, a workspace, a computer, just assisting them generally with how to do that. You can partner with your local health department or a pharmacy. There are pharmacies that are right now saying, yes, I will come to work sites. You can, complete a form and we can come out to you to administer that vaccine. You can apply to the state to become an authorized vaccine site. That's not something that I, as an employment lawyer, would necessarily recommend from a health and safety perspective if you're not in the business of delivering health and safety vaccines to individuals. I'm not sure you want to necessarily apply to become an authorized vaccine site, but definitely, if you do, you want to make sure you've got the right people who are administering the vaccines. And then you've got, allowing flex time for vaccine appointments. It's sometimes in your state, it's hard to get an appointment. And if you can get one, you may need to go, immediately. So you want to be able to be flexible with your work staff if they're able to get off work to go get the vaccine. And then same thing if there is an adverse reaction after the first or second shot, to provide some time off to recover for those employees. The next approach that we talked about a little bit beyond just encouraging is incentivizing them. And, President Biden's day one OSHA executive order said that employers should make COVID-19 vaccine available at no cost. He went on to say at a press release, a press conference a couple months ago, really that employers should go and actually compensate employees for encouraging them to get the vaccine. So the federal government is taking the position, encourage, incentivize, make available as much as you can to your workforce. There is a proposed rulemaking under the prior administration for wellness programs. And they're saying that wellness program incentives, those kind of incentives of, I want to get my workforce to be healthy, so I want them to join a gym, or I want them to do this 30-day challenge, exercise challenge. And if they complete it, I'll give them some, $250 incentive cash bonus. Under the Trump administration, the rulemaking came out that those incentives should be de minimis. And so it was a conflict with, well, what the current government is saying is that you should be making these vaccines available, even incentivizing them with some compensation. How does that balance with the de minimis exception? So on February 1st, a coalition of about 40 business groups, including the U.S. Chamber of Commerce, did ask the EEOC to clarify this issue. We're hoping new guidance is expected soon, but we have heard of, a number of different businesses that have provided incentives that ranges from, extra PTO, 4 hours off if you need time off to take the vaccine, and that time off is paid. Some employees are giving straight out cash bonuses to employees who say that they've gotten the vaccine. Others are getting gift cards. I have one client that has decided to, rather than directly incentivize employees through direct compensation, for every person who gets vaccinated, they're donating money to the ACLU. So there's a lot of different creative ideas that you can do based on your company, what's unique to you and what's unique and what would be valuable to your employees. So a question I get most often is, can employer mandate the vaccine? So I want to make it a condition of employment that everybody has to be vaccinated in order for them to come back to work. The answer is yes. You can do that legally, but that's something you want to take into consideration very seriously. As I said earlier, because the COVID vaccines currently are only authorized through the FDA emergency use, the mandate may be riskier because we may find out in 5 years or so that there are some complications. Who knows? But I also think too, there's a lot of other attendant issues that I'll talk about with mandated vaccines. Certainly in some industries, it makes a lot of sense for vaccines to be a condition of employment for safety of their workforce and the public. And you're thinking about healthcare, you're thinking about retirement communities, long-term care facilities. Those types of industries could make a lot of sense. Other industries, it might not make some sense. We're hearing that senior executives are saying they're considering mandating the vaccine, but very few have. And it's important to note that some state legislatures have considered legislation, or legislation is pending, to both either encourage or even prevent employers from mandating the vaccines. None of those legislations have passed the state legislatures in terms of preventing employers from mandating the vaccine, but that's one more place you should look when you're thinking about your holistic vaccine program and how you implement it at work. And then I've said there are some unions, while I've had experiences where the unions have participated in encouraging employees to get vaccinated, other unions in different sectors have objected to vaccine mandates as a condition of employment. So let's talk about some legal considerations of a vaccine program. If you're going to either educate, incentivize, or mandate the vaccine, it's important that you have a written, clear policy in place. It's probably not something you already have, so it's important that you think through, this is something you develop and issue out to your employees. We were hoping that there was going to be some federal guidance with respect to an emergency standard for employers in all industries, and this vaccine policy would be a great place to implement that as part of your overall kind of return to work safe and healthy protocols. Those of you that may have employees in California or Virginia, or I think Michigan, Oregon, a couple of other states, you're aware of already some of those state mandated emergency temporary standards. And so you might already have some of those policies written down and distributed to your employees. And I would suggest, if you're gonna talk about vaccines, that would be the place to do it. So think through some of the tactics of how you want to roll out such a policy. Do you want to apply it only to customers? Some of you may be on workplaces where you interact with people from, third parties or vendors or other contractors. Do you want to apply that to them as well? Particularly if you've got maybe a temporary labor force that's working hand in hand with your employees, would you want to implement it to them too? So think through, does it apply only to your employees or to third parties as well? Are you going to encourage employee to receive the vaccine? I mean, outwardly state that. As I said, that comes from the senior leadership, and that can have a lot of credibility. If you're going to mandate the vaccine in particular, you need to have a process to request an accommodation. I'll talk about the two types of accommodations that employees can request in a few slides, but it's very important that any written policy have this process to request an accommodation, very similar to the way your employee handbook has to request an accommodation under the Americans with Disabilities Act. Think through whether you want employees to present written evidence of their vaccine. Do you want to show them a vaccine card? Do you want to keep a copy of the vaccine card, or do you just want to have them present it? We'll talk about the pros and cons of that when we talk about privacy issues, but that should be written down as well. If you decide to provide assistance with either on-site access or helping employees register for vaccines or identifying places where they can get the vaccine, that's where you can identify that in the policy. And then the policy also will talk about how, if there are incentives, if you're going to pay for costs associated with the vaccine or any other paid time off. And then finally, as every good policy should have, a no retaliation, that employees won't be retaliated by requesting an accommodation or by otherwise participating or adhering to this policy. So with respect to privacy, I get a lot of questions about what you can and cannot ask employees about their status. So you are able to ask employees if they are vaccinated, and you can ask employees if they can demonstrate that they're vaccinated by showing you documentation of their vaccine card. So I would recommend here that if you're going to do that, you just, have someone show it to you, whether, it's by video or on phone. I don't necessarily think you need to keep a copy of the vaccine record. That's a medical record, and that could be considered something that has to be kept confidential in a personnel file. So I would, at this point, my general recommendation is not to ask for a copy of the card, but to just ask them if you want to, and particularly if you're going to incentivize employees with some type of cash payment, that you want to make sure that people actually have been vaccinated in order to be eligible for that incentive. But some of the things that you can't do is you can't disclose a particular employee's vaccine status to coworkers. So just like any other medical condition, the employee should really direct that information to one person in your organization. Person is probably in human resources. That person is the gatekeeper. That person needs to keep that information confidential, and you can't disclose other coworkers' vaccine status to others. So if an employee comes to you and says, well, I'm not coming back to work unless I know that everybody is vaccinated, or I'm not going to come work on my floor until I know the person sitting next to me, Joe, is vaccinated. Well, you don't have the right to disclose Joe's vaccine status. If Joe wants to say one way or the other whether he's vaccinated, that's Joe's decision. But as an employer, you are not legally authorized to share what one person says or does not say about their inclination to get vaccinated. So with the ADA accommodations, if you decide that you are going to require a vaccine and somebody says, I don't want to take the vaccine, or I'm not allowed to on the recommendation of my doctor because I have a disability or I have a medical condition, what can you do? So under the Americans with Disabilities Act, you're only allowed to exclude employees from a workplace if they pose a direct threat to the health of others, which can't be eliminated or reduced by a reasonable accommodation. And that direct threat standard is pretty high, and it requires an individualized assessment based on 4 factors. You want to think through right now that the EEOC does consider COVID-19 to meet this direct threat standard. That may change as vaccines become more prevalent or if we get some herd immunity, but at least right now, the direct standard under the ADA is met by the COVID pandemic. But you also want to think through different accommodations given the nature of your workforce and the employee-specific position. And you can rely on CDC recommendations to determine accommodation options. The second thing that you want to also consider is if you require a vaccine and the employee refuses to be vaccinated because of religious practice, what can you do? And it's the same analysis as for an employee with a disability, right? So you have to provide a reasonable accommodation unless it would pose an undue hardship under Title VII for religious accommodations, or undue hardship under the Americans with Disabilities Act for a medical condition. And an undue hardship is more than a de minimis cost or a burden on you. Religious accommodations are a lot trickier because according to the EEOC, you should really assume that an employee's request for an accommodation is based on sincerely held religious beliefs, unless you have some objective basis to question the religious nature or sincerity. And I think with this vaccine, it could be very easy for an employee to get a card from a religious official, a pastor, a priest, to say that they don't want, they need a religious exemption under the Title VII. So one of the things that I think is really challenging about mandating the vaccine, and why I kind of put an asterisk about, yes, you can mandate it legally, but should you, is because I would anticipate a lot more people requesting accommodations under a mandated vaccine policy than in a normal course. I think that people, because of some vaccine hesitancy and because of various medical conditions, may decide that they don't want to be vaccinated right now. And so it'll be a lot easier for them either to get a doctor's note or to get a note from a religious person to get that exemption. And then you have to engage in that interactive process with that individual to say, okay, you've presented an exception. You are somebody who, is an essential function in my company. I need you. You're the CFO, right? I need you. You do our, our accounting. I need you in the office day to day. It's not a position that you can work from home anymore. Then you're going down that rabbit hole of, are there other accommodations available? And as I said in my previous slide, you can't exclude that individual from the workforce if no other reasonable accommodation could be met. And at the end of the day, you could even terminate an employee. But that really might not be the best course of action for you or your company or your workforce. So I think that's where I, as a best practice, tend to find my guidance with clients is to encourage, recommend, incentivize if you'd like, but maybe draw a little bit shy of mandating because of the really tricky issues that the accommodation analysis will come into play. If you're a small employer and you don't have a very strong, sophisticated, deep HR group, handling accommodations could be a real landmine. And it's probably not something that you want your HR team to be focused on in the near term. All right, we talked about this a little bit, but if you do get an accommodation request, what do you do? First, you want to train your managers on how to recognize a request for an accommodation. Hopefully, your HR team knows that with respect to other types of accommodations, but now would be another good time to roll out that training so that people understand what happens if someone does not want to be vaccinated. You should have standard forms and a process for workers to notify the employee of a request for a medical or religious exemption to a vaccine mandate. This is going to be, the process should be outlined in your policy that we talked about earlier, but in addition, particularly with respect to a medical exemption, there should be standard forms that a physician should complete based on a worker's essential duties so that they can understand if there's other alternative accommodations that might fit for this particular individual. And then you have to conduct an individualized assessment to determine whether a direct threat exists from a worker who refuses to be vaccinated. These are the 4 factors that I talked about earlier, both the duration of the risk, the nature of the harm, the likelihood that the harm will occur, and the imminence of the potential harm. And because the EEOC does consider the COVID-19 pandemic to meet these factors, if someone refuses to be vaccinated, you are able to exclude them. The question is there someplace else in the workplace that they can work? Are they customer facing? Can you put them in an office? Do they have to be out on a manufacturing floor? Do they have to travel? Those things, think through, are there other jobs that they could do if they refuse to be vaccinated? Or is the nature of their job such that they are so public facing or interacting with the public that you as a company believe that they should be vaccinated as a mandate? You want to engage this process like you would any other ADA accommodations in a flexible and interactive process. to identify any type of options that might not constitute an undue hardship. If you do find that it would be an undue hardship, you've got to document that situation in the case that that decision is ever ultimately challenged. And it's important to remind your supervisors and managers on the confidentiality obligations that they can't disclose if an employee is receiving a reasonable accommodation for either a medical condition or for a religious exemption, and or retaliate against an employee for requesting an accommodation. And it's my strong advice that before you decide to terminate an employee for refusing the vaccine, you do talk to counsel, because as I said, it's a challenging time. There was one employer a couple months ago that did fire somebody for refusing to be vaccinated, and it hit the front page of the New York Times. It was a small employer, and the last thing you want to be doing is making news. And there might be a lot of other things that could be like an accommodation, including, a leave of absence, time off, another position. And so definitely, while it's important to engage in this process, and even though you legally may be able to terminate an employee for refusing the vaccine, if it's a condition of employment, whether you should do so is another question. So let's talk for the last few minutes about what to do after the vaccine, and then I'll open it up for some questions. So what happens after the vaccine? OSHA, the new administration, issued new COVID-19 guidance that said even after you've been vaccinated, it's important to wear face coverings and remain physically distanced from coworkers and customers, even if you've been vaccinated, because it's not known at this time how vaccination affects transmittability. That's something we talked about earlier, that we think while it certainly prevents serious illnesses and deaths, we don't know yet if it can still be transmitted through asymptomatic individuals, even if you've been vaccinated. So you should still continue the same protocols that you have in place with respect to face coverings in your workplace. If you've got workplace workers in California, again, you're familiar with their COVID-19 emergency temporary standard. They issued this frequently asked question that said, must the ETS still be followed for vaccinated persons? And they said, yes, for now, all prevention measures must continue to be implemented. So it's not going to change your return to work protocols with respect to a face covering at work. Then last month, we got some new CDC guidance for fully vaccinated people, emphasizing mirroring what had been said earlier. So you can continue to wear masks and physically distance in public. 2 weeks after the second dose of the Pfizer or Moderna vaccine, or right after the Johnson & Johnson vaccine, you're considered fully vaccinated. You can visit indoors without masks, really with others fully vaccinated. It really should be others within a household. It shouldn't be 3 households together inside that are fully vaccinated. You can visit unvaccinated households if they are low risk, if they don't have a serious health condition, if they're considered generally in the low risk category. But you can also refrain from quarantining and testing following a known exposure if you're asymptomatic. So that's one of the biggest changes to the guidance in terms of if you are fully vaccinated and you have been, and you've been exposed to somebody with COVID, but you are not symptomatic, you do not have to have quarantine. You can return to work immediately, and you don't necessarily have to have return to work testing following that exposure. So that's another area that you can update your return to work policies or your SOPs if you have them. Some questions I get a lot about liability risks. We touched on this briefly. If you decide to arrange for a vaccine site at your workplace, there is a liability shield under the Federal PrEP Act. So that's there, although I do think that there are some other attendant risks if you decide to do that. Just again, ensuring that the individuals that are administering the vaccines are healthcare workers. If you do mandate the vaccine and someone gets ill from the vaccine or a side effect or something like that, those are going to be covered by your workers' compensation carrier. It really, you won't have a direct liability to executives or the company itself that'll be handled through workers' comp. If you don't mandate the vaccine and you simply encourage it or otherwise incentivize, there's really very little liability that would ever attend to the company if an employee got sick. I have heard of some shareholder suits for allegedly misleading statements about COVID-19 risks and SEC disclosures. So if any of you are public companies, definitely want to make sure you're accurately reporting any attendant risks in public documents. We are seeing that certainly the new OSHA is having a much stronger enforcement priority, particularly in industries that are high risk. So we're seeing that they are focused on healthcare, long-term care facilities, mortuary, really those high risk individuals, to make sure that those are safe workplaces. Office, construction, other type of workforces are lower risk, and hopefully we'll see some different OSHA enforcement priorities there. We were supposed to get a federal OSHA emergency standard on March 15th. It was one of the things that President Biden said in his first executive order, is that he authorized OSHA to come up with an emergency standard by March 15th. March 15th has come and gone, and we haven't seen anything from Fed OSHA. Fed OSHA, has been murmuring that there are some standards, that they're in the process for review. We haven't seen anything filed publicly with OMB, the Office of Management, which must review such agency protocols before they are released. So we're not exactly sure where Fed OSHA is on this front. We also heard some mumblings that Fed OSHA may divide the standards into two standards, one that impacts very high risk industries and one that addresses every other type of workforce. So I do think it might be coming soon. We're already exactly 1 month away. So stay tuned. Our firm is closely following that development. We've got some close contacts in Fed OSHA, and so we're trying to understand better what's happening, and we'll certainly be releasing information if there is an emergency standard, because one of the questions that I'm getting a lot is, well, when that emergency standard comes out, if it does, will we have time to ramp up and comply with it? I think Virginia allowed employees 30 to 60 days to ramp up to get used to it. I can't recall if California did or not. We think that Fed OSHA will say, nope, this is effective immediately. You need to have all of these ducks in a row and these health and safety protocols ready and on the books, but they might not enforce it for the next 30 to 60 days. So think through, if you haven't already started to come up with protocols for a return to work plan, or if you already are, if you've been working this whole time, if you have protocols for maintaining health and safety in the workplace, which incorporates some employee training, which would incorporate some, social distancing and engineering protocols with respect to air transmission and, moving things around, engineering so that people our offices are 6 feet apart. All of that is what this emergency standard will require in a written plan. And that's the written plan that you can incorporate your vaccine policy as you think through what works best for your company. What is the best type of arrangement and approach based on all the factors that we talked about today? So with that, I think I will close and let you know just before we get to questions that, our firm does have a COVID-19 task force, which I lead along with many of my other colleagues. It's a great resource. We've got a lot of frequently asked questions up there. We have a lot of our blog posts. We blog about this almost weekly. So we have prior articles about these topics. We've got a lot of resources on, if you administer the vaccine at work and somebody gets sick, is it, OSHA recordable and reportable? So a lot of different types of reporting, as well as things beyond just vaccine, but just general COVID-19 in the workplace. So please take a look at that, and hopefully that'll be a good resource for you going forward. And with that, Anne-Marie, I'm happy to answer any questions.
Thank you, Kara. We have a couple that are kind of focused around the privacy considerations. So this is going back, you had talked about, that you could ask an employee to provide documentation, but by asking for that proof, isn't that a direct, someone's asking, is that a direct violation of HIPAA? What covers them that they can ask that?
Mm-hmm. So most employers are not covered by HIPAA because you are not a healthcare provider. You're not the really recipient of healthcare, personal identifying information in a healthcare setting. So generally you can rest assured that HIPAA does not apply to you as an employer. The privacy considerations are going to come under the EEOC. What kind of medical questions can you ask that would run afoul of the Americans with Disabilities Act, or any other maybe state-specific privacy considerations? But for the most part, because the EEOC has considered the pandemic to be a direct threat, you are able to ask those types of questions about someone's vaccine status and not run afoul of the Americans with Disabilities Act. In fact, the EEOC has said just asking the question, are you vaccinated, is not a medical inquiry. Now, what happens though is the next question is, are you vaccinated or are you going to be vaccinated? And someone says, no, I'm not going to be vaccinated because I have a health condition or because I have X, Y, and Z. Now maybe that individual is disclosing more of a health condition than they had previously disclosed. And then you are now in information and excuse me, that has to be kept confidential. So the initial question is okay, just be very careful about where subsequent questions could lead so you're not eliciting more information than you need to know.
Okay, and another question is, what happens if an employee tests positive? Does the employer have the right to release the name of the employee without his or her consent? Could they just say, bring that to the attention if it happened on a job site, just for everyone who was on that job site, or if it's office, hey, we have someone who was in the office this week, he or she tested positive, please, take these measures. What is your advice on something like that?
Great question. So if someone has tested positive and you need to do an analysis, an investigation in your workplace to do some contact tracing or otherwise that they may have been in close contact with somebody who had been exposed, you need to do that in as confidential way as possible. You are not allowed to disclose the individual's name. What you do need to say is, we had an employee who may have been exposed or who tested positive and may have come to work, exposed to COVID. They were in this area of the facility during these hours. It may be obvious to a lot of people that who that person is, because everybody else is at work except for one person on that is now taking sick leave. That being said, you cannot disclose the name of the individual. You have to do it in a much more circumspect way, but you absolutely should do some contact tracing and inform your employees if you think that they were in close contact with that person while they were at work.
Okay, and this next one is goes back to responding to an accommodation request. They're just concerned about their exposure, their liability. So I know you had mentioned about conducting an individualized assessment, whether or not there's a threat from a team member who refuses to be vaccinated. How much is the employer exposing themselves to being sued if they were to choose that route, knowing that every state varies about letting employees go?
I would say, I'm not sure, Emery, if I completely understand the question, but I would say that if you mandate the vaccine and someone refuses the vaccine and requests an accommodation, it's important that you again, go through that analysis. And as long as you go through that analysis, you're documenting it, right? They're providing the forms. Let's say it's a medical reason. So they complete the form, the doctor completes the form and say, this individual has this medical condition, and as a result, it's my recommendation that they do not get vaccinated. Please accommodate them in some way outside of their job. You then sit down with them and look at their job description. What are their essential functions? Is there something that this person can do or not do as a, in the job, get paid? Is there another open position that they're qualified for? If not, are you comfortable with giving them, leave of absence for a period of time until maybe more vaccines are available or different vaccines are available or something about their medical condition changes? So it's hard to say. And then at the end of the day, if you decide that there's no alternative, no accommodation that wouldn't create an undue burden, this person is so critical to your operations. It's like I said, it's a key executive. It's someone who has to be in the office every single day to address employee concerns, or someone, is someone's IT. It's not somebody that can do their job from home. If it really would be an undue burden and you consult with counsel, and you have the right to terminate. Where the liability is, I do think that we are going to see an uptick in litigation from employees in the next couple of years as it relates to COVID. We've already seen a huge uptick just as it relates to retaliation complaints for people who are questioning whether their employer are following the right type of COVID protocols. I think we're going to see similar types of issues of, when the vaccine comes out. So I can't promise that you're not going to have a litigious employee, but I do think there are a lot of things that you can do to best protect yourself from exposure. And as long as you're following what the ADA provides in terms of responding to the request for an accommodation, engaging in that interactive process, documenting that process through the entire way, laying out all the different accommodations that you considered and what the employee's responses were, all of that is very beneficial to fending off a claim that you did not reasonably accommodate an individual.
Thank you. We have a few more questions. This next one is about incentivizing. If you are incentivizing, but an employee won't get that reward because of their religious or disabilities accommodations, wouldn't that be discrimination that everyone else who got vaccinated received that incentive, but the person who didn't get that?
Exactly. So you want to, in that incentive program, you want to have an alternative for those individuals that can't receive the incentive because of an accommodation some other way. And that question hasn't really been clearly, I think, answered or thought through carefully, because that's exactly right. I think that it comes up in a lot of the wellness incentives. We were addressing those under the Affordable Care Act many years ago, where someone said, okay, well, I want to have a weightless, a walking exercise. And someone says, well, I've got a broken ankle and I can't participate in the walking exercise, but I still want the incentive. You still had to provide an alternative way for that individual to receive the incentive. Here, if you're, providing paid time off, or some other cash incentive, I don't know how you don't also give that incentive to individuals who are unable to get it because of the vaccine. I think it's the easiest way is just to allow those individuals to get the same incentive no matter what.
Okay. And last question, can an employee refuse to answer if they are vaccinated?
Well, it depends if you mandate it or not. If you mandate it, and it's a condition of employment, they have to answer the question. If you don't mandate it and you simply encourage it, I don't think there's any consequences for them not answering it. But I think not answering it, is probably an answer in and of itself.
Okay, thank you. And it looks like we're nearing on the end of the hour. So I just want to make sure that everyone's aware again of the handouts, and Kara's information is listed in the handouts. So if you want to go ahead and download that PDF, if you are having trouble with that, please email me and I can provide you her contact information or just email you that PDF. On behalf of AWCI, I would like to thank Kara Maciel and all of our attendees in joining us for today's webinar. Our next AWCI webinar will be April 29th. We're going to discuss an economic analysis of pre- and post-pandemic world. So thank you, Kara, and again to all of our attendees, and we wish everyone to have a healthy and productive day. Thank you.
Thank you.